My name is Dr. Charles Simone. We're here today with Ryan, who's going to tell her story about sinusitis and what's happened to her. And this is Ryan W. and her mother, Linda W., and her father, Rich W. And we're going to talk to Ryan now about what happened to her. Go ahead, Ryan.
Okay, so I am a basketball player. I'm committed to a Division I school to play basketball in college, and during the fall, I was really highly competitively training for my season, my upcoming season of my last year of high school basketball, and I started and I just did not feel well. I got diagnosed with, I had just had a sore throat, I got fever, so I did end up going to a walk-in doctor and was prescribed an antibiotic. So later, about 2 weeks later, I just had a cough, and the cough just was not really going away. So I just kept trying to push through. My season had started, and I got an ankle injury, and it was just a lot was just going on. So then I kept coughing, went back to my pediatrician, and got diagnosed with I just had a lot of stuff going on with my lungs, and I got put on a Z-Pack. Then took that for 5 days, and it just didn't go away. So I kept coughing and coughing. I had fevers, I had headaches, and I just didn't know what was going on. So then I just kept trying to push through my season playing, and I just knew that I was not myself, and I got a little down and depressed, and I ended up going to see a therapist, which she did help me, but I knew that in my mind there was something else that was going on and not physically feeling myself. So I did end up going to a psychiatrist and was prescribed an antidepressant medicine. And then I knew that something was medically wrong. So I was back in my pediatrician probably another 3 to 4 times in that month, and nothing was helping me. So then one afternoon actually, I got home from school and I had a meltdown. I was just I couldn't do this. I had a 102.8 fever, and I just told my mom and dad that I could not physically play in this game that we had that night, and that was it. So the next morning we were that was it. I was up the whole night. I was trying to think about what was wrong with me, and we woke up that morning and was okay, we're going to figure this out today. This is not going on any longer. So we ended up going to Dr. Simone, which was the start of my recovery, and I was diagnosed with a major sinus infection. I was all clogged here and here, and I realized that this was the problem, and that everything, anxiety, depression, was out the window, and that this was the main problem that we needed to fix. So I, later that day, went to the pediatrician just to make sure that everything else was okay, and I actually got diagnosed with the flu that day too. But that only lasted for a short period of time, but I realized that the main problem was this sinus infection that had been going on for a while.
Right, that's her story. It's a very common story. And how we diagnosed her was very simple. We used special equipment. We used a transducer to look at her maxillary sinuses like this. And we saw ultrasound waves showing that there's fluid in the sinuses. She also had some toothache in the upper teeth, which is classic about this. We then instructed her about what happens. When you have fluid in the sinuses, the fluid circulates among all the 4 sinuses here and in the middle ear. This fluid in the middle ear causes dizziness, lightheadedness, whenever time you bend over or turn your head. And here's where the action is here. You can see this is the nasal area, and this is the port of exit from which these sinuses drain. When the port closes, this membrane port closes, fluid builds up, gets into the middle ear, causes pain in these sinuses and dizziness, etc. What causes it to close up? Air flight, premenses, dust mites, allergies, low barometric pressure, snowing, rain, overcast. When that closes up, the fluid builds up, fluid has sugar in it, Bacteria love it. They jump in, cause an infection, and then slowly this will leak out from the sinuses back here, this port, onto the vocal cords. And then the patient starts doing that. It goes into the airway, causes vasoconstriction, shortness of breath, wheezing, and it can go also into the stomach, causing nausea. Once you clear this up, anxiety, shortness of breath will all clear up. This is pretty much what Mary Decker-Slaney had when she came here. Same thing. She was a known athlete who had problems with vasoconstriction and bronchial constriction. This was cleared up, and then she scored indoor world records. And this has happened to Ryan. There's now a list that you can see. It's on our website, but you can go over this. You need to frequently wash your hands and face to decontaminate yourself. And mucus production and swelling is caused by dairy, citric acid products, dust mites, air flight premenses. What you should do is use nasal saline many times, every 30 minutes if you had to. It's cheap, doesn't hurt, there's no problem. Use steam water with eucalyptus. Proper hygiene, proper hydration, hydrogen peroxide gargle, multiple vitamins, zinc tablet, vitamin C, 500 to 1,000. Quercetin, very important. In fact, beats out Tamiflu. Quercetin, 500 milligrams twice a day. These are all things that one can do to promote proper sinus hygiene. And after only a few days, Ryan started feeling better, scored many points in the next game, I think 30-some points, and got to her old self. So here we are. This is a remarkable story of a simple problem that often goes overlooked by many doctors. Thanks very much, and thank you, Ryan and her family, for participating with us.
Thank you.